But if we're just slowly putting them on this trajectory to take more and more medications, what are we doing really? Are we drug dealers, or are we really about health? Let's get it, let's go, let's get it, let's go, let's get it, one life, I gotta live it. Is this thing on? Hey, how's it going? It's Dr. Blake once again with another video about nutrition. And this might be one of the most important videos you ever watch when it comes to nutrition. And I know those are big claims, but just stick with me. For most people, they don't really have a good grasp on this, and that includes physicians. So if you're a doctor out there or a medical professional and you're treating patients, pay attention to this video. It's very important, and I think it can help you help a lot of other people. Okay, so we're going to talk about insulin. And if I was to ask any medical professional what insulin does, they would tell me insulin is a hormone that is secreted from the pancreas whenever the pancreas notices a rise in blood sugar. Okay, and then when the hormone is secreted, it allows the cells to take the blood sugar outside, take the sugar outside of the blood and into the cells. And essentially you have the antagonistic hormone called glucagon, which essentially does the opposite. So whenever your blood sugar is too low, glucagon is now activated and allows the liver to secrete sugar into the bloodstream in order for your body to use it. That's what they would tell me, right? That's all it does, right? But it's way more complicated than that, because we need to understand that there are people that have high levels of insulin, and we never really talk about that. Okay, so what happens when you have high levels of insulin? Hyperinsulinemia, which is what this video is talking about. We end up with things like type 2 diabetes, but that's just one of the things. It also is linked to strokes, heart disease, obesity, dementia, Alzheimer's disease, arthritis, fatty liver, osteoarthritis, migraines, and hypertension. Elevated levels of insulin will lead to hypertension in most people. It forces you to retain water, it forces you to retain sodium, and then you end up with hypertension. We have to put you on medications, and we try to just keep playing this balancing act with medications, but we never really address or even look to find out, do you suffer from a condition that is leading to this? Okay, so there's a lot of things that elevated levels of insulin do that no one's paying attention to. Polycystic ovarian syndrome. Those people have high levels of insulin. Okay, so now that we know that, hey, insulin does a little bit more than just shuttle sugar into your cells, it also is responsible for fat storage, for amino acid storage, for blocking the breakdown of fat. That's a big thing that it does, right? So if you're someone that has high levels of insulin and you get put on this cookie cutter diet protocol and you wonder why you're not losing weight, well, that might be because you're not doing something that's going to allow for you to lower your insulin levels low enough that your body is going to get into the fat burning mode. That's just a fact. That's happening to lots and lots of people. All right, so when we have these cookie cutter diets, but we all have different physiological and metabolic responses, it makes it really impossible for you to have one diet that fits at all people. And that's what we try to do in the nutrition community, say everyone should eat like this, everyone should eat like that. And that's not what this video is going to be about. This video is going to be about teaching you how to eat for you and for your goals. Okay? Now, insulin is not a bad molecule, not a bad hormone, right? Look at a person that's type 1 diabetic that is untreated. Those people are skinny, right? You need insulin in order to gain weight, to gain fat. If you don't have it, you are going to be emaciated. You will be skinny. So when you have somebody that's saying it's only calories in, calories out, insulin doesn't matter. Well, if it matters in order for you to put on weight, don't you think if it's too high, it's going to impact your ability to lose weight? We'll ponder on that for a little bit.
The prophecy is true.
Yeah, it's not just calories in, calories out. I'm sorry, right? There are other things in play. That for a large amount of people, yeah, you can stick to that simplified approach. But you need to understand we're in a obesity epidemic. We're in a diabetes epidemic. We're in a hyperinsulinemic epidemic. And we cannot just give people cookie cutter diets for CrossFitters and think it's going to work for someone that has chronic health issues that have been going for years. Okay, so that's what this video is really about, is that we need to understand that there's something else going on that doctors aren't looking at, that people aren't looking at, and it's affecting the health of our community as a whole. All right, In medicine, we just have the hyper focus on sugar, right? When you got diabetes, I got the sugars, right? We'll test your hemoglobin A1C, and then we'll see that, oh, it's a little bit elevated. Well, but it's not that bad. It's just pre-diabetic. In order for you to become pre-diabetic, you've had to have high levels of insulin for years, right? So if we would have tested that a couple years ago, we could have made those modifications instead of saying, oh, you're pre-diabetic, it's not that bad. We know most people that are pre-diabetic are going to go on to get diabetes. So as medical professionals, we're not doing our job if we're catching someone at pre-diabetes and then they become diabetic and then we put them on more medication and then they eventually end up having to take insulin. Okay? Obviously, not everyone has to take insulin. Some people do the oral medications instead. But if we're just slowly putting them on this trajectory to take more and more medications, what are we doing really? Are we drug dealers or are we really about health? Okay, and I understand we only got a limited amount of time to talk to people, but we need to do better than what we've been doing. And that starts with understanding the whole mechanism of all these things going on instead of cherry picking different parts of the pathology and saying, oh, let's throw a drug at it and see if something corrects itself. Okay? And I know there's not that much money in this, so that's another incentive not to do what I'm telling you to do. But we have to be better as a medical community. I know I'm just getting started in this stuff, but I've been focusing on nutrition my whole life. Right? And most doctors have not been focusing on it ever. And that's a problem because we are responsible for the health of other people and we do not understand the basic fundamentals of what is being done in the body that's leading to a lot of the conditions that we're treating. So what is the hemoglobin A1C? It is essentially an average of your blood sugar measurements over the last 3 months. Okay? That's just a super simplified version of it. There's way more to that, but that's what it is. Okay. However, your blood sugar doesn't say anything about your insulin because you can have super high levels of insulin and your blood sugar could be normal. Okay, so there are better tests that can tell you the state of your insulin in conjunction with your blood sugar. So there's something called a HOMA-IR test. There's something you can do. You can do a fasting insulin test. You can do a C-peptide test. There's a bunch of better tests than just the hemoglobin A1C. But either way, the intervention at all, regardless of all these tests, if these numbers are high, the intervention is pretty much going to be the same. It's going to be stop doing the things that led you to the position that you are in right now. And we'll address that shortly. Okay? And why should you care? Well, if this is happening to adults, it's now happening to kids because we live in a society that supports a certain type of nutritional habits and exercise habits that are going to make this much worse. So every child born today is going to most likely have a shorter lifespan, even though we have better medical resources, we have more education, we have more everything, more resources. But for some reason, if you're born today, you have an early death sentence, right? Because the adults in the room aren't making the decisions to keep people healthy and aren't paying attention to the things that they need to pay attention to. We're paying attention to comfort, and the comfort is coming in the form of foods that are not serving our bodies, and they're just tearing them down. Okay? That is a fact. That is what's happening. And until someone makes a difference or makes a change, it's just going to continue to get worse. So that's why you should care, because it doesn't just affect you, it affects the people that come after you, it affects the people that, if you're a doctor, it affects the people that you're treating, it affects your kids, it affects everybody if you're not paying attention to health instead of just medicine. And this isn't just a fat people problem. This is a everybody problem. Over 80% of the people have hyperinsulinemia, depending on the age demographic. It's a lot of people, okay? When over 30-40% of people are diabetic, or 60% of people overweight, and all these numbers are so elevated, and it now becomes abnormal for you to be normal weight or in the healthy range, that's a problem, right? When the BMI of 30 is probably more so the average than the BMI of 25, that's a problem. And I understand the BMI is not the best measurement in the world. My BMI is like 28, 29. So according to that thing, I'm almost obese. But that's because I have a lot of muscle mass. That is different. That's not normal. Like, most people are not at the BMI of 30 plus because they work out too much. All right? Most people, it's because metabolically they're unhealthy because they're doing things that they don't even know necessarily are negatively impacting them. Okay? And if you're skinny, you're not impervious from this, right? Because Your ability to be skinny or to be fat is essentially comes down to your personal fat threshold. Right? If you're somebody that has a pancreas that can secrete loads of insulin, then you're going to continue to gain weight. And then you may never become diabetic. Those 600-pound people in my 600-pound life, a lot of them are not diabetic because they have the ability to continuously pump out tons and tons of insulin. You might be someone that's a little bit skinnier, that you pumped out a little bit of insulin, you hit your fat threshold, you can't pump out anymore, your pancreas is like, I'm done. And then when I check your hemoglobin A1C, it's like 10, 12. Every time I see a skinny diabetic person, their hemoglobin A1C is so much worse, right? So they're dealing with all the ramifications of elevated blood sugar a lot quicker versus the overweight person, which is dealing with the ramifications of a significant amount of insulin. So they both have problems, but they're just different types of problems. And then when that really big person becomes diabetic, it's really hard to manage because their insulin levels and requirements have to be so much higher. When I see people, they're on 100 IUs of insulin, I'm like, what the heck? Those are typically bigger people. Okay? So I know that was kind of complicated, but I want you to understand that just because you're skinny, just because you're fat, we're all suffering from the same issue. Okay? So what are some things you could do? Okay? The first thing is we got to stop snacking as a community. We just got to stop snacking because every time you eat a meal, you're spiking insulin. Okay, so we need to reduce our meal frequency. That's the first easiest thing to do. And there's levels. You can get more restricted than this. So the next thing that you can do is you can incorporate some sort of intermittent fasting, or what I call time restricted feeding. Okay, so that means instead of eating all day, every day, three meals a day, and then having the snacks, you probably need to only eat twice a day. Unless you're an athlete, unless you're active and you're really going hard in the gym, twice a day is reasonable. So that way your body has time to let the insulin levels go low enough so that way you get into a position where you're producing ketones, you're using fat for energy, and you're allowing your body to use this alternate source of fuel. Because if you keep eating all this stuff, your body's never going to tap into the fuel that's on your body. Okay? That's just what's happening. And if you have high levels of insulin, because you've had chronically high levels of insulin, you have to be a little bit more restrictive to get those levels low enough so that way your body will allow for that fat to be liberated and burned. Okay? Because insulin will prevent fat breakdown if it's really, really high. So it's not just calories in, calories out. Yeah, that will play a role for a lot of people. If you just did that, for a lot of people, that might work. But for some people, if you've been chronically dieting, you've been trying this forever, you've been big your whole life, as you say, that might not work for you. And you've probably tried it already and it wasn't that successful. You have to be a little bit more restrictive in the types of food that you're eating. So that comes into different types of foods. Okay, so what foods stimulate insulin the least? Foods that are high in fats. So like avocados don't stimulate, they're not going to stimulate insulin very much. Even bacon. So that's why the whole keto people eat bacon. So like having high fat meals will not stimulate insulin that much, and it's more satiating. Does that mean you need to drink oil or eat bacon? No. But just be aware that if you're eating a fatty meal, insulin is not going to spike as much as it would, say you had, versus a high carbohydrate meal, where it's going to spike significantly, and then protein's in the middle. So what I like to recommend is have a meal that is predominantly proteins and fats as your first meal of the day. And you're only going to get 2 meals. And then your second meal essentially could be more protein, more vegetables, and some fats, some healthy fats, avocado, salmon, things like that. Okay? That's what you would have to do. If you're on the spectrum where you're significantly overweight, you're significantly hyperinsulinemic, you have all these other conditions that are related to that, you're going to need to be restrictive. Your body's going to get into ketosis if you eat that way. But I'm not going to tell you to like drink coconut milk and drink bacon grease. Like if you like bacon, that's fine. But the problem that I see when people eat that way, is that whenever they're eating lots of bacon and then they're like, you know what, I want some fries with that. They start adding all that other stuff into it, and then it just makes their whole condition worse. So I would say stick to the healthier fats like avocados and stuff like that, and salmon, and not necessarily so much bacon. Okay? But I will make another video in the future where I like really delve into the diet. These are like just some basic recommendations. Okay? Because we cannot cure diabetes with medication. The type 2 diabetes is just like the end result of having chronically high levels of insulin for many, many years. And everyone's going to get this if they're not paying attention to their nutrition. Okay? If they're not adjusting these things. Everyone just gets it and they're like, oh, it runs in my family. No, it does not. It's because no one runs in your family and no one changed their habits in your family. Everyone's doing the same thing. People in families eat the same thing. But it's not something that everyone has to get. And you can reverse it. But you can't reverse it with insulin. You can't reverse it with metformin. You can't reverse it with all of these other drugs. And you can't reverse it with a low-fat diet in most cases. Okay? You have to. You can get bariatric surgery. It works pretty well. But I wouldn't recommend you cutting open your guts for something that you can manage without the trauma of surgery. You just incorporate some fasting, a low carbohydrate, high fat diet, high protein diet, some moderate exercise consistently, and get away from the processed bullcrap that you've been eating. And you will reverse all these issues. You'll make it much easier for you to lose weight, achieve your body goals, and most importantly, get healthy and stay healthy. All right, so if you like this video, if it was educational and it helped you out, save it, send it to a friend, and take some of this advice and make a change that's going to benefit you and everyone else around you. All right, it's been a pleasure. Dr. Blade, once again, take care.